Actually got a few rooms in our Zoom rooms. We're going to go to Zoom room B where we have public health. They were adequately sequestered, socially distant from Sam while she was on. We have Janela Carrera, who's of course the spokesperson, and Annette Uggan, who leads the contact trace division. Annette, I know you got a big CDC call, so we'll just start. Give you the floor. If you could tell us the status of testing, contact tracing, maybe a little bit more behind the numbers that we're seeing. If you could, Annette Uggan again from the Department of Public Health and Social Services.
Hi, Hafide. Unfortunately, we continue to see, double digits every day with new cases, which again it results in looking for close contacts, be it at the house setting or at work. And so we've just been seeing an increase, because we're encountering new positives that have large family households, or they live like in a family compound, or they have relatives that are nearby. And so there is, again, like Dr. Cabrera said, it's a cultural thing. We're going back and forth to each other's houses. We're eating together, spending time together. But unfortunately, we're letting down our guard because, that's the family. We love them. We're secure with them. And unfortunately, we're seeing it spread in there. And then these individuals bring it back to their homes and back to their work site. So again, it's something that to really encourage and emphasize to people, please stay home if you don't have to go anywhere, and to practice the social distancing even with your family and loved ones, because again, there are those individuals who are asymptomatic, don't exhibit anything, and they unknowingly and innocently are going around and spreading it, unfortunately, to the people that they love or their close friends and contacts.
Right. Do you guys have any information on any of the results from the rapid engagement testing event from yesterday? I know Art gave us during the press conference. He said 29 out of 78, but that was the mid-afternoon report. Do you guys have any new numbers to share with us on how, I guess, successful that project was yesterday, at least?
Yes, it was reported out. Oh, sorry. Go ahead, Janelle.
Yes. Yeah. So out of the 124 swabs that we conducted yesterday, 48, and we had 76 negative tests.
Wow. And this, wow, the 48, were they all, I want to say, within house? Yeah, that is. Like
39%.
Can you break that down in terms of like households?
I think that's the data that we're still compiling. It's hard to really say at this point. Our team is still putting all of those numbers together. It's less than 24 hours since we did all the swabs. It's probably something we can get back to you. Yeah. But when we did observe yesterday, there were multiple households where it's small unit, 1 to 2 bedrooms, and multiple people living in those households. We had some households where there were, 10 plus people living in one unit. There were some compounds where there were 2 to 3 homes in one compound, right next to one another. And so those were some of the observations that we made yesterday. That's it. Like what Dr. Cabrera was saying, Dr. David was saying, at yesterday's press conference. That's sort of the areas where you can. It's easy to spread COVID-19 amongst family members.
Right. Do you know if like children, or a lot of children in this 48?
So when I was looking at the data, we didn't have a breakdown for the age, but the average age was mid-20s. That may include children. I did see some children who were part of the testing, but I unfortunately at this time I don't have the age breakdown.
Mm-hmm. There was something that Dr. Hoa had mentioned during his interview earlier today, and he was talking about if it were up to him, he would recommend that the positives would be moved to the government isolation facility. Do you know if these 48 positives today from yesterday, are they still staying in their homes, or are they being taken to or requested to move to the government isolation facility?
That would be
So oh, sorry, go ahead, Annette.
no, because we have to do it by a case basis, and I know Janella can add more. She was there out in the field, but we look at every household because again, there's some considerations of what if it's the parent that's positive and they're the only ones who can take care of the minor children. We cannot separate the minor child from a positive case if that's the sole caretaker. You know, as much as possible, we educate them to, you know, wear your mask in front of your children and to sanitize, you know, as much as possible. But unfortunately, we do not want to separate a minor child from the only caretaker, and so they would stay together. But we would not move that individual with the child to the isolation facility. So they would stay at their house.
So Annette,
Exactly.
if the house is not up to the if it doesn't have the separate bathroom, separate bedroom, and all the things that make a house successful to self-isolate or whatever, can they still stay in the house, or do you guys make a call that, oh, this is not, you're just going to give it to everybody in the place?
So there is the opportunity that the household members who test negative, that should they ask to be separated, that they can be requested to move to the quarantine unit, which is totally separate.
Wow.
So those are again the considerations house to house, and we would have to factor in the different scenarios and then see what's the best fit to not only protect the household members who are exposed, but also for the positive individual. That what if it's the household member who's a caretaker of the positive individual? Then you can't separate them, and you have to make sure, again, educating them with the proper, you know, hand washing, wearing the mask as much as possible. But we've had instances where we've had caretakers who were negative stay to take care of the positive case, and they did all the necessary precaution and safety measures, and they stayed negative.
So out of the 48, how many people were moved to the government isolation facility?
So those are still in the works with our other teams that handle the isolation and the transportation. And so again, it's based on if the individual is requesting, then we have to coordinate with that as well as with the transport team, and then they prepare the facility to receive the individual or individuals requesting to be moved, or they have to be moved because their home is not conducive to properly separate.
Have you received any requests or have made a determination that they must be moved?
Those are still being processed. Again, this is all happening yesterday.
All right.
And again, it's a separate team, and it's a multi faceted approach. Again, like the rapid engagement team that went out, you know, Janella was there, but there were multiple partners out there assisting public health. And then the coordination too is goes across from our agency to other agencies who are our key partners that assist us with transportation.
Janelle, you said 124 swabs were done. This is just for Zero Down, or do you have more swabs to do in this particular area?
No, that was actually for both Gilbaza and Zero Down.
Okay.
Yeah, and so we go back today because, you know, of course, we weren't able to reach all the homes in both neighborhoods. And so we go back today, and then we continue to, you know, go door to door, and all the homes that we weren't able to reach, we'll go back to those residences and offer the free testing to them as well.
Do you have just an estimate on how many homes you are left?
Unfortunately, I don't have that number on me. I can get that number to you later today.
I don't know if you guys covered this already, but in going around, were there any households that just said, no, we don't want to get tested?
That refused?
Yes, there were some residents that, you know, refused. We also found some homes where, you know, nobody was home. So yeah, there were, and you know, if they refused, you know, we weren't, of course, not going to force them to get the free testing. You know, that's their right, so we respect that.
Annette, everybody we've had on the show this morning has been consistent in saying that what we're seeing now is really a vapor trail, I guess, of what has happened 2 to 3 weeks ago. That being said, 2 to 3 weeks from now, what do you think our situation is going to be, given that you're right on the front line investigating these cases, the positives, and all that?
Unfortunately, yes, it takes about 2 to 3 weeks to see these new cases and the contacts and the links, as we continue to investigate and we see how far it's spreading out. So again, we're continuing to see double digits every day. So it will still take a while for us to bring these numbers down. And so again, it's asking everyone to help us to get those numbers down. Let us know if you've been in contact with a positive case, and so that we can investigate and see, are you a close contact that needs to be tested? We ask the people who have been tested and waiting for results to please stay home. Those who are sick, symptomatic, stay home, please, because that's the only way that we can help, bring down the numbers and to try and contain this, because again, it is community spread. We're seeing it mainly in the north, but again, you're also seeing in other villages on the sit rep. The shade of blue is getting dark in more than just Jigo and Dedido.
Mm-hmm.
So it's something that unfortunately we cannot do this alone. It will take a few weeks for us to bring it down, but we need everyone's help because we're still seeing double digits and it's high. And again, the greatest concern is the hospitalization rate. The number of people going to the hospital. We continue to hear and see reports of, we've waited so many days. We've been sick for 5 days, 7 days, 2 weeks before they finally go to the hospital, which is causing an influx and it's overwhelming GMH, So again, please seek medical care as soon as possible. Don't wait until it's so severe that the only option is to go to the ER. Again, both health agencies, we're here for the health and safety of our community, but we also need the individuals to be responsible in the community-wide effort to help us stop this.
Annette, are you guys tired? You've been saying the same thing for 8 weeks. Are people I know the government deserves its share of the blame, but I'm just so disappointed in our community. How do you guys keep going every day when it just keeps getting worse every day, even though you're asking people to do the things that they have to do to flatten this curve and to kill the COVID?
You know what? It's our job. We are public servants. We're here to help, whether it's good or bad. Public health is a calling. You have to be passionate. Even though, we take the hits, more people hear about the negative, but when we have the one or two positive that pushes us through, that we help people say thank you to us. We even just by getting them tested or giving them the isolation or quarantine facility option. So those little things are what helps us get through and to continue to fight. And again, it's the teamwork. We can't, internally with our team, we help each other, we pick each other up across with our key partners, and again, it's just you have to be passionate about public health in order for us to continue to do this. And it's all about ultimately helping our people, protecting our people, and making sure we don't have any more sick people or any more complications or death, because that's the ultimate goal, is to help our people. And we're one island. They're our brothers and our sisters, and we have to help them.
Yeah, I just want to add to that. You hear about all the negatives all the time, but what you don't hear about are the small victories. The little things, the small thank yous, the people that we also help that you don't hear about, and those are the things that also get us through. In addition to the internal support that we give to each other, the people that we help that you may not hear about, and so and as Annette put it so eloquently. Public health, it's a passion. When we help our people and we see that help is successful, even if it's not, but we know that, it's benefiting our island, that's really what gets us through this.
Man, Janella, what's harder, working at Adelup or public health?
Adelup.
No, both jobs are beneficial. So.
Come on, what's your
both
really
rewarding in different ways.
Classy.
So today you guys are going back to Jigo, zero down Gilbaza. What's the plan for tomorrow? I saw there's community testing that Sam was talking about.
Yes. Yeah. So we are going to be doing a community drive-through testing up at Jigo Gym. And so, as Sam had mentioned, this is similar to what we did in Umatic and Telefofo. It's pre-registered. So we're offering 200 tests. And, and again, we're working with the FSM Consul General, our community leaders in that community. And, hopefully it's a success. So far, I don't know how many registrants we've had. But again, we want to reach out to the communities, hoping to get these down.
And this is just for the FSM community, or it's everybody in GGO, just so we're clear?
Well, we did work with the FSM Consul General and their community leaders, and so they're the ones who are actually reaching out to, and registering the people. So I'm not sure exactly how they coordinated that effort. It might be best to see, exactly who or what areas or what, I guess, who they reached out to be able to register the people on their end.
What about plans? Are there plans to move then to Dedido and do rapid engagement team action there?
So right now, of course, as you know, we started with a rapid engagement team. This is something that we, when we mobilized, it was just in the last 24 to 48 hours. And that's why it's called rapid. Once you get the task, you engage aggressively and then mobilize. And so after we're done with this project, we regroup our after action report. We discuss any challenges that we may have had, make recommendations for improvements. And then after that, we look at our successes, apply those, and we talk about future engagements and look at areas, look at the evidence, look at the data, and then apply that in areas where we know may need intervention. So we'll discuss areas moving forward, and maybe Dedido, areas that we know need that immediate intervention. So once we can determine that, we'll make that announcement.
Okay. Can maybe Annette? I'm not sure, but we had on earlier this week, and they said that they had assisted with the move for contact tracers to move into the Hakaputan building. Do you have any information on what that's about?
Yes, the Joint Task Force is assisting public health as we're trying to bring on more staff. Again, public health is homeless due to that fire last November. So we need more space. We're currently spread out over 4 to 5 facilities. And actually to help with our efficiency, communication, and data flow process, our isolation quarantine unit, as well as our investigation unit where the investigators and contact tracers, we're spread out over 4 to 5 places. So to consolidate us into one physical space, at least ideally on the same floor, so we can be walking across to each other, or even on the same building, because as it stands right now, we have Agana, Manila, Tumuning, and Dedido, where staff are all spread out. And so that by providing us a bigger space, we are again using our ELC COVID funding to hire more bodies, 14 alone just to help with contact tracing and case investigation. But we need to have a bigger space so that we can have more people onboarded and to help us with this fight against COVID. So the location where the war claims was processed, that's where they are preparing for us, so that we can have more office space, and so that we can also make sure that our staff have the proper spacing, social distancing that is needed. And so that is something that we are looking forward to have a consolidated physical space for these 3 units.
When are you looking to move there?
I don't have an estimate date. All this has been happening just over the past week and a half, and Joint Task Force I know is moving on it. And so they're the ones assisting us with all the infrastructure and the setup. So they're trying to get it done as quickly as possible.
Okay. And just before we let you go, what kind of tests are you guys using for the RET response? I'm sorry?
Rapid ID now.
Rapid ID.
Is that, I'm sorry, is that like
Is that the rapid one?
serology or what?
It has a device, and so it's still a swab, but it's like a small little tabletop device. And so this is the one that we actually distributed out to like AMC and
15 minutes,
FHP.
Okay.
Right.
And so it's done within 5 to 15 minutes. You would have a result.
Right.
Yeah.
Annette,
I
I
can
just
send
go ahead.
videos and pictures that I took from inside the mobile lab.
Thank
Okay,
you,
thanks.
Danella. Annette, I know we've spent so many weeks together, and I just wanted to reach out to you just on a personal level to let you know that we support the work that you guys are doing. I know that a lot of times you're in over your head, but you're a trooper, man, and we definitely appreciate you coming on and getting that information. And I think that it's really key that you guys know that it's people like Annette, people like Dr. Ann, the staff, the classified staff over there that are in our government. They're unsung heroes. They do this not just during COVID. They did it before COVID. They're going to do it after COVID. So I
And
just want,
and they also have families too.
yeah, and that's one thing I wonder about you, Annette, is on a personal level. We've seen, and I know you've had people that you maybe not physically rub elbows with at public health, but you guys have had your share of people hit by the virus. I mean, we know Chima got it, and a bunch of people got it. So does that play into your mind at all when you're out, investigating these things? I mean, the risk to not just yourself, but your friends, your family, and your loved ones.
Definitely. I mean, it's something that are we going to bring it home to our family and loved ones? Here we are helping others, but about our own family, so that's something too that as much as possible, we're trying to reduce exposure. That's why we do a lot of phone calls, just so that our staff too, we're working late into the night. There's times that 9-10 o'clock we're making calls versus being out in the field, especially in areas we don't know. Again, we don't have the luxury of sending out a team of 2 or 3 to do this contact tracing. So by doing it over the phone, even the investigation, it allows us to have more bandwidth for staff to contact all these individuals. But yes, it is definitely something. It's been a long response in all my years of public health. This is the longest I've ever had to experience. And again, it's about uplifting each other at work. We are family here. And again, to help each other to push it through. And again, making sure that, we remind our staff, if you need time, some downtime, take it, check on your family and your friends, or even just for yourself, even if it's a few hours, most people know, I'll just take a couple hours, not a day in it, which, again, that goes back to the passion and the commitment of the staff and makes it why we can push through. So we thank you for that. But yes, again, it's not for the glory or whatever. It's our job. It's again, for our island and for our people and ultimately for ourselves. By us helping you, you help us. We protect each other. So, we appreciate that. And again, it's a team effort for all of us.
And Janella, we definitely appreciate having an in over there at Public Health and the accessibility that you provide us with and getting these people on. So you're just as appreciated. Ladies, we got to go. Thank you again. Yeah, and we're getting a lot of comments here. Thank you, Public Health. Really, I mean, it's Friday. You guys have been busting your ass, and I want to say thank you, and I mean it sincerely.
Viva Public Health!
Appreciate it. Thank you so much.
Okay, grab
We'll
some.
bring it back to the team.
Grab
And
some.
thank you to KUAM for the opportunity, giving us a platform to be able to share, all the great work that we're doing at Public Health.
Right on. Well,
Really.
we consider ourselves pandemic partners, Janella.
Thank you.
Write that up.
All right.
Pandemic
There you
partners.
go.
You got 2 or 3 of those today.
Hey, there's some virtual Latiza that Bree just made for you guys as a gesture, so grab that on your way out, okay?
Okay.
All right.
Thank
Take
you.
care.
It's her
Just walk
first time making it, so I don't know, but just it's a thought that counts.
Take care, guys.
Okay, bye.
Stay safe.
See you. That's that, just 9:03. Man, we got to take a really quick break, and then we're heading into KUAM News Decision 2020. But before we do that, we definitely want to catch up with Maria Pangilinan from the Guam Election Commission. It's 9:03. We're KUAM FM, and I got